speaking with Dr. Matthieu Godin, who's just presented some of the first results on the use of TAVI in patients who were inoperable, refused by surgeons, but still at lower risk. Doctor, what did you find using the approach? How did TAVI perform?
So we have analyzed in our population of patients implanted in our center by Edwards valve the result of the specific population of patients with low EuroSCORE. These patients were declined for surgery because of comorbidities not included in the calculation of logistic EuroSCORE, and we sought to evaluate this specific population, and we find the most important result is the absence of death at day 30 in this specific group of low EuroSCORE versus a mortality rate of 11.1% in the other group.
And what approach did you use? Did you always use, did you try the transapical?
We performed this implantation by two approaches, the transfemoral approach and transapical approach. Transfemoral approach was performed under local anesthesia in 70% of population, and the other patients were implanted under general anesthesia by transapical approach. Sorry.
We're seeing now a lowering of risk coming from the partner trial in the use of TAVI. How should a clinician place these results? Should this be used now in lower risk patients or not quite yet?
No, we can't actually extrapolate this result to a low risk population, because these patients were at low EuroSCORE, but that doesn't mean that patients are at low risk for TAVI. There are other comorbidities that increase the risk of this type of procedure. But it was interesting for us to evaluate this risk, and probably we have to evaluate some criteria for risk, specific risk of TAVI, and we have probably to perform to make some pivotal study on this specific patient before to extrapolate and before to compare to surgery, which is actually the gold standard.
For Global Medical News Network, this is Patrice Wendling from Paris.